Dear student, today we are going to talk about the limb development and the muscular system. Our learning objectives are, and these learning objectives are very important. We will discuss about how limb buds are formed, what is the apical ectodermal ridge, where it is formed, hand plate and foot plate formation in the limb bud, hyaline cartilage model for the purpose of bone formation, then finger and toes formation by the process of apoptosis and rotation of limb bud finally. These 6 important points are very much necessary to learn about the limb development. So in case of limb development, we have to give emphasis on these 6 points. First of all, we will see how limb bud is formed and where it is formed. This is a 4th to 5th week embryo. Here we see one limb bud. This is upper limb bud and this is lower limb bud. So at the end of the 4th week of development, limb buds appear as an outpocketing from the ventrolateral body wall. From the ventral lateral body wall, there is 2 limb bud. One is upper limb bud and another one is lower limb bud. Upper limb bud appears 1 to 2 days before the lower limb bud. Now come to see how this limb bud is formed. What is their composition? Limb bud composed of mesenchymal tissue derived from the parietal layer of lateral plate mesoderm, and this mesenchymal tissue layer is covered by a core of ectoderm, and this ectoderm are the cuboidal epithelium. If we see the picture, this is the limb bud and this is the picture of the composition of limb bud, that is structure of limb bud. Here we see the mesenchymal cells. This is the mesenchymal tissue that derives from parietal layer of lateral plate mesoderm, and it has a ectodermal lining. This is the ectodermal lining over the mesenchymal tissue. So there is 2 limb bud from the ventrolateral body wall, and this limb bud composition has 2 parts. One is mesenchymal tissue, another one is the lining is the ectodermal cell, surface ectoderm. Now come to our second point. What is apical ectodermal ridge? Apical ectodermal ridge means the distal border of the limb bud. This is the limb bud, and the distal border of the limb bud shows thickening of the ectoderm. So as because it lies at the apex of the limb bud, it is known as apical ectodermal ridge. Third point is the formation of hand and foot plates. Here we see, this is the limb buds, upper and lower. Here we see that this limb bud distally form the hand plate and foot plate by a constriction. This is a first constriction that appears in the limb bud for the purpose of formation of hand plate and foot plate. And the proximal part of the limb bud then again have second constriction at the elbow level, so that the main parts of the upper limb and lower limb is now recognized in the embryo. So this is the limb bud during the 6th week of embryo, formation of the hand plate and foot plate in the distal part of the limb bud, and by a first constriction, and gradually in the proximal part shows another constriction, second constriction here, so that we see the limb bud now becomes the upper limb and lower limb. Hyaline cartilage model. After the external shape is established, the mesenchymal cells of the limb bud now begin to condense and then differentiated into chondrocyte. This chondrocyte ultimately give rise to a hyaline cartilage model. This model foreshadow the future bones, future long bone. By the 6th week of development, first hyaline cartilage model foreshadowing the bones of extremities are formed by these chondrocytes. So here we see these are the hyaline cartilage model. This model ultimately give rise to the future femur. This is the hyaline cartilage model for the tibia, this model for fibula. In this way, the main parts of the upper arm bones are formed from the hyaline cartilage model. And from this model, by the endochondral ossification, bones will be ossified. Now come to the finger and toes, how the finger and toes are formed. This is the, here we see how gradually the fingers are formed. First of all, this is the hand plate. And in the apical ectodermal ridge area, there will be cell death. And after the cell death, the remaining area will form the hyaline cartilage model to form the tarsal, metatarsal and phalanges. Cell death, which is known as also the synonymous term is apoptosis in the apical ectodermal ridge, separates the hand plate into 5 parts. Under the influence of ridge ectoderm, mesenchyme condensed to form cartilaginous distal ray. Death of the intervening tissue between the rays give rise to finger and toes. This brown color area indicate the death of the cell death by the process of apoptosis to form the fingers. And these are cartilaginous model for the formation of metacarpal and phalanges. Endochondral ossification of the bones begins in the embryonic period. We know that there are 2 ossification center, one is primary and one is secondary. Primary ossification center appears before birth, usually from the 8th week of intrauterine life to the 12th week. Between 8 to 12 week, all the primary centers for the bones are appeared. And from the primary ossification center, we get the part of the bones which is known as diaphysis. Primary ossification center will give rise to the diaphysis, and these diaphyses are ossified by the endochondral ossification process. And after the primary ossification center and diaphysis formation, both ends of the bone has secondary ossification center which appears after birth, and this area is known as epiphysis. So epiphysis develops from secondary ossification center. In between epiphysis and diaphysis, there is epiphyseal plate of cartilage, and this plate of cartilage continue to increase the bone length by the up to the growing period of the fetus, that is up to 25 years, in some cases 20 years, there will be presence of epiphyseal cartilage. After that period, epiphyseal cartilage disappears and epiphysis unites with the diaphysis. So this is the endochondral ossification from the hyaline cartilaginous model. Another important part for limb development is the rotation of the limb bud. Here we see the limb bud appears from the ventrolateral body wall, and in the center there is axis. So upper border is known as preaxial border and lower border is known as postaxial border. Upper limb bud rotates 90° laterally and lower limb bud rotates 90° medially. For this reason, thumb lies laterally and great toe lies medially. Now come to the point how joint is formed. Joints are formed when chondrogenesis is arrested in a specific area, and this area is known as interzone. This is the interzone area where future joint cavity will be formed. At this area, cell death begins. There is a formation of joint cavity, and the surrounding mesenchymal cell differentiate into articular cartilage, then menisci, ligaments, and the mesenchymal cell surrounding the joint cavity will give rise to the joint capsule. In this way, synovial joints are formed. Limb growth. Development of each limb proceeds proximo-distally into three components. Stylopod, from this part, humerus and femur is developed. Zygopod, radius, ulna or tibia fibula developed, and autopod, these are the all small bones of the limb develops. This is the limb bud, and this is the how the stylopod, zygopod and autopods give rise to the limb. Now some clinical conditions related to the bones. In case of fetus, primary ossification centers at a specific time period like 8 to 12 week of intrauterine life. And these centers are important. Radiologists use the appearance of various ossification center to determine whether the baby has reached proper maturation age. And ultrasonographically, fetal age can be determined by calculating the femoral length. Femoral length is also an important to determine the fetal age. What are the limb defects? There are various limb defects like meromelia, which means partial absence of part of extremity. Amelia, complete absence of the one or more part of extremity. Phocomelia means long bones are absent. Rudimentary hand or feet are attached to the trunk by a small irregularly shaped bones. And micromelia means all segment of extremities are short. Brachydactyly means digits are short. Syndactyly means fingers or toes are fused. Polydactyly means presence of extra finger or toes. And ectrodactyly means absence of a digit. These are the pictures of some limb defect. Here the digits are short. Here we see the fused digit, syndactyly. This is polydactyly, and this is the cleft foot. They are great toe fused with the second toe. Middle toe is absent. Fourth and fifth toe are fused. Cleft hand also the same. Osteogenesis imperfecta. In this condition, here we see the upper extremity and lower extremity are short and bowed. Bowing, there is bowing of the extremities. And this is the just opposite. Here all the limbs are tall, slender. So this syndrome is known as Marfan syndrome. And there is also thoracic cage defect, pectus excavatum or pectus carinatum. Excavatum means protruded sternum, carinatum means inverted sternum. There is also some important condition like congenital joint contractures, congenital absence or deficiency of radius, amniotic bands that causes ring constriction or amputation of the limb or digit. Congenital hip dislocation due to underdevelopment of the acetabulum and head of the femur. So up to this our limb development. Now we will go to the muscle development. We know that the limb muscle are skeletal muscle. During the 7th week of development, limb muscles appear as a condensation of mesenchyme near the base of the limb buds. Ventrolateral cells of the somite migrate into the limb to form the muscle. This picture shows the somite differentiation. This is the somite. Here we see three components of the somite: sclerotome, dermatome, and on the each side the myotome, muscle cell. This is the dorsomedial muscle cell around the neural tube and notochord. This muscle cell ultimately give rise to the muscle of the back. And this muscle cells is known as primaxial muscle. And these ventrolateral muscle cells migrate and unite with the lateral plate mesoderm and give rise to the body wall muscle, limb muscle, and other muscles. So these dorsomedial cell will give rise to primaxial domain and responsible for development of back muscle. And these muscles will give rise to the body wall muscle, limb muscle. How? Because these ventrolateral muscles cells migrate into the lateral plate mesoderm to form the limb musculature. This is the segmental arrangement of the limb musculature. Initially, muscles are segmented according to the somite from where they are derived. Each myotome receives its innervation from the spinal nerve derived the same segment. This means the muscle cell from which segment they derive, they also carry their own nerve supply from that segment. These are the limb muscle. Initially, they are splitted into flexor component and extensor component. I want to say an important point, that is the flexor muscles are supplied by ventral divisions and extensor muscles are supplied by dorsal divisions of the nerve. After initial segmentation into flexor and extensor compartment, there is additional splitting and fusion of the muscle occurs. As a result, single muscle may be formed from more than one original segment. For this reason, we see that one muscle is supplied by 2 or 3 spinal segment, because they not only comes from original segment, they also take some part of the upper or lower muscular segment due to additional splitting. Spinal nerves. Spinal nerves play an important role in differentiation and motor innervation of the limb musculature. That means when the muscle develops, the spinal nerves play an important role for its functional differentiation. This is the branches of the spinal nerve: dorsal division, ventral division. Here we see the segment of the spinal nerves, and this is the limb bud. When the limb bud grows, it carries fibers from this segment, and they also maintain an orderly sequence. Here we see that 3, 4, 5, 6, 7, 8, T1, T2. That is, the dermatomal pattern although changes, but with the growth and rotation of the extremities, orderly sequence of the spinal segment is maintained. Here we see in the adult dermatome, there is also the maintenance of the orderly sequence of the segment, spinal segment. Now come to the source of skeletal muscle. Head musculature derived from somatomeres, and the musculature of the axial skeleton, body wall and limb derives from somite. There is an important point: lateral somatic frontier. What is this? This is a well-defined border between the somite and the parietal layer of lateral plate mesoderm. This lateral somatic frontier divides the muscular domain into two parts: primaxial domain and abaxial domain. What is primaxial domain? It is the region, it is the mesodermal region around the neural tube and notochord, and this contain the somite derived cells, paraxial mesodermal cells. And what is the abaxial domain? This abaxial domain contains two type of mesodermal cell. One comes from somite and another comes from the parietal layer of lateral plate mesoderm. This abaxial domain will give rise to the back muscle, and abaxial domain mesoderm that comes from two sources give rise to the body wall limb muscle. So this is the picture. Yellow color line indicate the lateral somatic frontier. This separates somite from the lateral plate mesoderm. This is the lateral plate mesoderm. This is the table which shows the derivatives of primaxial domain and abaxial domain. In the cervical region, these are the muscles comes from primaxial domain, and if we see there maximum muscles are the muscles of back and around the vertebra, and these are the body wall muscles, abdominal muscles, thoracic wall muscles, and these are the limb muscles. So abaxial domain gives rise to limb muscle and body wall muscle, and primaxial domain gives muscle of the back and thoracic wall muscle, intercostal muscle. Muscles of the back are apixial muscle innervated by dorsal rami, and muscles of the limb and body wall innervated by the ventral primary rami. Now come to the point how skeletal muscles are formed. During differentiations, mesenchymal cell give rise to the myoblast. And these myoblasts, huge myoblasts are formed by the mitosis. They are fused and give rise to a multinucleated muscle fiber. Why the skeletal muscles are multinucleated? The answer is that myoblasts are fused, myoblast cells are fused and form multinucleated muscle fibers, skeletal muscle fibers. This is the mesenchymal cells. They are differentiated into myoblast. The myoblasts are aligned parallel to each other. Then they are fused and form the myotube. And within the myotube, there is appearance of myofibrils, and ultimately multinucleated muscle fiber, skeletal muscle fiber is formed. Next is the cardiac muscle source. Cardiac muscle, that is the myocardium, develops from splenic layer of lateral plate mesoderm surrounding the endothelial heart tube. This pink color area is the splenic mesoderm. It will give rise to the myocardium. Smooth muscle. Smooth muscle, we know that comes from splenic layer of lateral plate mesoderm. Most of the cases, but there is some exception, like in case of coronary arteries, tunica media comes from neural crest cell. And in case of sphincter pupillae and dilator pupillae, muscles of the pupil and the muscle tissues present in the mammary gland and sweat gland comes from ectoderm. So all the smooth muscles, maximum part of the maximum smooth muscles comes from lateral plate mesoderm. And two another sources, neural crest cell and ectoderm. So up to this is our today's lecture. If you have any question, you can ask me.